Hi, welcome to the discussion. The question for today is a 35-year-old male presented with history of nasal bleeding. On examination, there was petechiae and purpura. There was no family history of similar complaints. Investigation revealed normal platelet count but increased bleeding time. There was delayed clot retraction. What could be a diagnosis? Now, carefully look into the history. There is history of nasal bleeding. There is history of petechiae and purpura. So, all these indicate that there is a superficial bleeding. So what do you mean by deep bleeding? Deep bleeding means bleeding into your joints or into your muscles, which is usually seen in deficiency of coagulation factors like hemophilia. Okay, so here it's a superficial bleed. This could be due to any problem in the vessel wall or problem with your platelet, either decreased in number or any function. So the next clue is normal platelet count and increased bleeding time. So what does this indicate? So bleeding time is one test to assess the function and number of the platelets. So your bleeding time can be increased either in a quantitative defect or a qualitative defect in platelet. So what do you mean by qualitative defect? Like decreased platelet count due to thrombocytopenia. Qualitative defect meaning your platelet is not functioning properly. So the clinch is delayed clot retraction. So what is delayed clot retraction? I'll teach you later. So with this clue, there is superficial bleed. You can exclude one disease, which is hemophilia. Okay. So now let us go how does a platelet function to understand clot retraction. All these orange color are platelet. So when you take platelet, your platelet has got two receptors. One is called GP1B9 and the other one is called GP2B3A. Okay. So what does these two receptors do? So this is GP1B9 and this is 2B3A. Okay. So this 1B9 helps in adhesion of platelet to the endothelium through von Willebrand factor, whereas 2B3A helps in aggregation of platelets through fibrinogen. That's what is indicated in the image. Okay, so this should be very clear. So 1B9 helps in adhesion, 2B3A helps in aggregation. So defect in 1B9 leads to a disease called Bernard-Solier syndrome, whereas 2B3A leads to Glanzman thrombasthenia. Now look at this image. When you collect the blood and keep, you will have clot formation, and after some time your clot will retract away from the sides of the test tube. So this is clot retraction. This is normal. Whereas when you see this test tube, there is no clot retraction. So this we call it as delayed clot retraction, which is seen in GT because there is no platelet aggregation. Okay. So to assess the function of platelet, we do a test called platelet aggregometry, where we add certain agonist substance which cause platelet aggregation and look whether your platelet is aggregating or not. So remember only this one. In Glanzman thrombasthenia, your platelet will aggregate only with ristocetin and there is no aggregation with other agonists. So whatever is indicated in this blue, it's normal. This is how normally your platelet aggregates. If it's in the top, there is no aggregation. So now in this graph, there is no aggregation with ADP, adrenaline or collagen, but there is aggregation with ristocetin, which indicates it is GT. Coming to the next graph, there is aggregation with ADP, adrenaline and collagen, but no aggregation with ristocetin. This indicates either von Willebrand disease or Bernard-Solier syndrome. What is the other thing you see in Bernard-Solier syndrome? You see giant platelets. Remember B for big. Okay. So to summarize, Bernard-Solier is a disorder of platelet adhesion due to defect in GP1B9. GT is due to defect in platelet aggregation due to receptor 2B3A. So now I told giant platelets, it can be seen in other conditions. Bernard-Solier, May-Heglin, Epstein and Sebastian, and small platelet is seen in Wiskott-Aldrich syndrome. So this is May-Heglin anomaly. You have giant platelets with inclusions in leukocytes. Okay. So giant platelets are usually seen due to MYH9 gene mutations. So the key to success is to focus on goals, not obstacles. So focus on your goals. Thank you.